One in one day.
You know what?
Exactly.
How mad is she right now?
Broadcasting from the First National Bank Tower. This is KLEKLP Jonesboro. The voice of Arkansas Minority Advocacy Council.
Jonesboro's community radio station. Your life, your music. KLEK 102.5 FM.
Good Friday morning, Jonesboro. This is meteorologist Tim Root with your KLEK 102.5 forecast. Partly to mostly cloudy, chance of a few showers today. Temperatures falling through the 50s. And it'll be partly to mostly cloudy, colder tonight, about 35 to 42, north wind 10 to 15. Partly to mostly sunny, around 50 Saturday. Chance of rain late Saturday night into Sunday. Mostly cloudy Sunday in the low 50s. Educate, entertain, and empower. We're KLEK 102.5 FM.
From Feature Story News in London, I'm Ollie Barrett. The global death toll from coronavirus is now over 10,000, according to Johns Hopkins University. California's announced a statewide order for 40 million people to stay at home to try and halt the spread of COVID-19. In the UK, retired NHS staff have been called on to return to work during the coronavirus outbreak. And South Korea is cautiously optimistic it's back on track to beat COVID-19 after new infections once again fell below 100 a day.
It's 9:01.
KLEK LP Jonesboro, the voice of Arkansas Minority Advocacy Council. It's now time for Community Conversations, a program focusing on the people working to make the Jonesboro community a better place, while offering viewpoints from all sides of the issues. The views expressed in this program are those of the participants and do not necessarily reflect the views of KLEK 102.5 FM, the voice of Arkansas Minority Advocacy Council, or our underwriters or sponsors.
KLEK 102.5 FM. Good morning to you on your Friday. It's March 20th, 2020. This is Community Conversations. Cato Wonder is in the studio with you. I am joined by Kabila Jones, host of Community Conversations, and joining us via phone is Dr. Shane Speights. Dr. Speights is the Dean of the NYIT Medical School on the campus of Arkansas State University, and he is also the City Medical Director for the city of Jonesboro as well, and he is here today to give us updates on the coronavirus. So if you are watching this video on Facebook, please share this video. If you are tuning in on the radio, then please encourage people to tune in as well, because we want to make sure that we get this information out there. So Dr. Speights, I'm going to just let you take it away to let everybody know what's going on with the latest with the coronavirus in the city of Jonesboro and in the community.
No, I appreciate it. Thank you for letting me take a little bit of time to at least talk to your listeners and get some good information out there. For most of you, you've probably been watching this on the news. You really can't get away from it. It's all over social media as well, and certainly all over the radio too. This, started over in China and has now become a global pandemic, which means that it's really moved throughout lots of different countries, causing lots of different illness and deaths. We became a lot more concerned with it when it really started hitting Italy and Europe really hard, and then has now moved into our United States through California and New York. We've now started to increase the number of cases in Arkansas, certainly significantly over the past week. We're moving up, I believe. Last count I saw, we were close to 80 cases or so. We do have had our first case here in Craighead County that was announced yesterday. We believe that there are certainly other cases out there that we just are not familiar with yet because we've been behind a little bit on our testing. As the testing continues to ramp up, we will find more and more cases. The big thing that your listeners need to know, this is not the flu. People talk about that and they say, it's not that big a deal. It's kind of mild. It's not, that's not really the case. This is a brand new virus that's new to the human body, which means that your body's never seen it before, and so we're not quite sure how your body will react to it. Many times your body will respond viciously, so to speak, and can sometimes cause more harm than good. The virus itself attacks the lungs, where all the breathing occurs and everything, and so that's why people have cough. About 70% of patients will have cough. About 90% of patients will have a fever. Some of those fevers can get high. Early on, there was information that came out that said that about 80% of people have mild to moderate symptoms. We want to better define that. What we mean by that is only about 40% have mild symptoms, to be honest with you. And mild symptoms are like, I don't feel good, I ache, I'm in bed for a couple of days, I may get over it within several days to a week, I could still have symptoms within 2 weeks. Moderate symptoms mean that you can end up with pneumonia. You won't end up in the hospital, but you'll still be down for several days or a week to 10 days or more, not feel good at all. It can really knock you down and make you hurt, but you wouldn't necessarily end up in the hospital. But you can still have a viral pneumonia. So I want to make sure people understand that. For a long time, we were saying that the young folks weren't really affected very badly. There's a little bit of truth to that. We're seeing more and more young people affected now. And so about 40% of the cases in the state of Arkansas, the young are being affected. And there's different variability on how bad they're affected. They don't seem to be affected as bad, but they are more likely getting infected than we thought. So we're still looking at the data there and trying to really figure out what the biggest risk factors are. Right now, those at the biggest risk that we know about are our elderly and those with chronic diseases. Now, a chronic disease is if you take a medicine for really any reason every day. So if you take a blood pressure pill every day, you got a chronic disease. If you take a diabetes pill every day, you got a chronic disease. And so those people are at risk, because your immune system is not where it needs to be able to fight the virus off when it comes in contact. A lot of people are asking me, well, what can I do to protect myself? Well, the first thing is we want to make sure that if you do take medications, you take them regularly unless your doctor has prescribed them. Make sure you're up on all your vaccines, including your flu shot. And it's not that the flu shot will keep you from getting this virus, but the flu shot will keep you or reduce your risk of getting the flu. And we don't want you to get the flu on top of this virus because we still do have cases of flu circulating in our community. The biggest thing you can do is to really start trying to boost your immune system. And a lot of people ask, how do you do that? Well, unfortunately, here in the state of Arkansas, we actually rank toward the bottom in our health outcomes. And the biggest reason why is because we have a large number of individuals who are inactive. And that means that, to be honest with you, we kind of just sit around. We watch TV. We don't do a lot. The simplest thing is just walking around your neighborhood, getting off the couch and walking around and getting that blood flowing and getting those lungs moving. That'll actually help your immune system. And there's no reason to start, no better reason to start than right now, to be honest with you. Hopefully this rain's moving out and we'll be able to have some nicer weather and people will be able to walk around their neighborhoods and kind of get out and move around a little more. Because we do know that the better shape your body's in, the better you're going to be able to fight this virus off.
All right, and Dr. Speights, as both the city medical director and the dean of the NYIT, you have a connection to both the city and Arkansas State University. So I know that you've been in a lot of meetings with a lot of people. So what has the city and the university and other entities have been doing collectively to help to try to get a handle on things?
You know, I want to say, and you're right, I have been privy to many of those meetings. I'm very proud of how the city and the county and Arkansas State University has come together and met on this, as well as all the hospital partners here in the city and the region. Been a great collaborative, had group meetings and discussions about that and how to best prepare for it. Very happy with the direction we're moving in now. Some people say this is a stretch in terms of, wow, we shouldn't have school or we shouldn't have church or, you know, a lot of this we just need to shift our thinking. It's not that you can't have school. We just need to be thinking about how can kids do it from home. It's not that I can't go to church, but I need my preacher to be sending that by video instead of 150 people sitting in one room together. So we've got to rethink, at least for the time now and probably into the summer, how do we make things work so that we're not all in one room together? Because social distancing is the best way to prevent this virus from spreading rapidly. And that's what we're trying to do. We're trying to slow the spread of the virus so that we can catch up with either some medications or a vaccine. And right now, those are still several months or a year away from happening. So we've got to do everything that we can to slow the spread of it. They call it flattening the curve, and that's to try to prevent an increased number of cases of the virus, of people being infected by it at one given time. And so that's why we're trying to encourage people to kind of limit your travel. This is not the time to go on spring break, and I hate to tell people that, but this is the the worst time that I can think of to take off and go to Florida. I'll be honest with you. This is not the time to go to Florida. This is not the time to be really leaving the community. You're just going to increase your risk of getting it. You're going to increase your risk of spreading it. This is not the best time to be traveling. I hate to say that, but we're lucky we live in a beautiful state. We've got things that we can do outdoor here. We can take advantage of. Hopefully the sun's going to be coming out. We can increase our physical activity as well. But back to your original question, very proud of how the state, the county, Arkansas State University has all banded together. You probably already know this. ASU is starting to shift to online classes for the rest of their semester. NYIT is shifting similarly. I know many of you heard the governor's proclamation yesterday in terms of people need to start looking at how they telecommute, and he made that directive to all state employees. We've done the same thing here at NYIT. We're encouraging businesses that can do that look at how you can make that happen. There's some great technology platforms out there that we can be utilizing. We should take advantage of that now.
All right, Camille, do you have a question for Dr. Speights?
I do. Can you hear me okay? Lagenza may have to translate. Okay, because you are suggesting we take these precautions, which we should, yes. Do you foresee Arkansas going to a temporary, mandatory, I hate to use the word shutdown, but just quarantine?
Yeah, I know where you're going with that. So let's talk about that. Just yesterday, you heard that California basically went to a shelter in place. And what that means is that everybody in the state of California now is told to stay home. That's 40 million people.
Wow.
There's similar things that are going to happen in New York. You're going to see it in Ohio. The governor of Ohio has been very proactive. I'm afraid those are things that we're going to have to look at taking to be able to really stop the rapid spread of this virus. And that's what we're trying to do. The virus will spread, but it's up to us on how quickly it spreads. If we continue to have large gatherings, if we continue to have people out in large areas, the virus will just jump from person to person and continue to spread. And again, our most vulnerable population is our elderly, but everybody can get infected with this, and a good number of people will. But we want to take care of our elderly. We want to take care of the generation that raised us, so to speak.
Yes.
And this is the time to do that. So that, yes, I would certainly be in favor of stringent measures to be able to limit those social gatherings. I think that a lot of the guidance out now that we should have groups of 10 or less. I think those are important. I think the recent things that we've done in terms of restaurants and bars, I think those are important. And let me say this, let me be clear to all the listeners. I recognize there's an economic impact, and there is. There's going to be an economic impact, and people are going to have to rethink how do I deliver my goods and services in an environment where I can't be face to face with a whole group of people. How do I shift so that I can still deliver what I need to maintain my business? And that's going to be difficult, or in some cases almost impossible. And personally, I don't have a good answer to that. But I can tell you from a public health standpoint, those are going to be the steps that need to be taken to stop the spread of this virus. If we don't, then the problem is we're going to see what's going on in New York, what's going on in Italy, and I think we will then see a dramatic push in terms of what the crunch will be on our healthcare system. And we don't have a lot of capacity within our healthcare system. I know that some people may not realize that, but we don't have just lots of empty beds in the hospitals, empty beds in the intensive care units, and extra ventilators. That's not the way the system is set up. For example, in the state of New York right now, I know in New York City they were already at 80% capacity in their hospital. Their main hospitals in New York were already at 80% before this pandemic hit. They were at 92% in their intensive care unit. So they didn't have any wiggle room when this hit. And that's true for most hospitals across the country. So that goes back to why do we want to, quote, flatten the curve? It's because we don't want to overwhelm our healthcare system, and we don't want to be in a situation like they're in Italy.
All right, Dr. Speights, we definitely appreciate that. And, of course, if you are watching on our Facebook Live feed, if you have a question or a comment for Dr. Speights, you can leave it on our comments, and we'll be happy to ask Dr. Speights these important questions. You're talking about the ventilators. Let's talk about what that means and what they do, because there's been where I've been seeing on social media, there's a concern that there's not enough ventilators. And what would the ventilator do to actually help treat the virus?
Oh, So that that's a great question. Sometimes, and I'm gonna apologize. I try to talk in lay people's terms sometimes, and you get sucked into back to the doctor talk, so to speak. So this is a respiratory virus, and what that means is that it comes in through your nose and through your mouth, and it can go down and infect your lungs. When it infects your lungs, it starts tearing up a lot of the inside of your lungs, and so you can't then get oxygen in, you can't get carbon dioxide out, so the normal exchange that you need to keep all your organs healthy doesn't happen. It can get to the point where, to be honest with you get so much damage there, your lungs start to fail. When your lungs start to fail, we have to put you on a machine to breathe for you. That's what a ventilator is. So a ventilator, we put a tube down your throat that goes into your lungs, and we basically use that machine to breathe for you until your body can get over that infection. In this case, it'd be the COVID-19 infection. Now, that can take days, weeks, or months to get over sometimes.
Well, Dr. Speights, not to cut you off, but I had a quick question. So, is this potential lung damage permanent?
It can be, and we've actually started to see that in some cases, specifically in young people. Once they've gotten over it, we've seen lung damage show up on CT scans, even for those people that have recovered from it. So yes, sir, it can be. Not in all cases, but it can be.
Okay. I'm just sitting here thinking, and again, not trying to go and panic. I'm not panicked, but I'm thinking about other people and how they may feel, and just looking at the different commentary that has come forth from all over the world. Okay, if we have to move to a contingency plan to keep people in their home, I know you probably can't answer exact right now, but is there maybe some discussion about having medical professionals or trained professionals, in the hazmat field, take on some of those delivery services if it need be, if elderly need meals delivered or medical supplies or various other things, if we have to go to those measures?
Yes, ma'am. I think that's a great idea, and that brings up a really good point. Let's think about this for a second. In most of our communities, our elderly obviously are not only valued, but they're also a workforce. The elderly, they're the ones who man the food pantry, work at the food bank. They work a lot of times at our local churches. They're the volunteers at the Red Cross, the Salvation Army. So now we've got to find another workforce to be able to step up as we're asking these individuals to stay home and limit their exposure to this virus. So to your point, I think you're exactly right. I think there will be, as we shift, there will actually be jobs created and opportunities created for individuals to be able to offer those services that are needed in terms of being able to deliver this, whether it's delivering groceries to the elderly, whether it's delivering healthcare services, just whatever it may be. And I also want to take this time, too. This is a time really for our communities to come together. We've got a great community here in Northeast Arkansas. We've got a very loving community. We pitch in. We help each other out. Over the next several weeks, this is going to be a time for us to do that, to think about the neighbor next door who maybe shouldn't be getting out and getting groceries because she's, 85 years old. Maybe making sure she gets her trash out or things like that. And so this is when we need to be thinking of each other and kind of making sure that we help out and take care of our own, so to speak. You're already seeing that around the community. You're already seeing that throughout Northeast Arkansas, and I think that's phenomenal, and I think that just speaks to the resilience of who we are as people in Arkansas and in Northeast Arkansas, that we want to step up and take care of our own. I think you'll hear more and more stories like that. We'll get through this, and I want to be clear about that. This is not something that we can't get through. We can and we will, but it's going to be different. It's going to be different over the next few weeks for people. It's already different now. I think that most people that are listening would say that, this time last week you didn't think we'd be here. So we're going to see more cases, and this is going to get worse, but we're going to get over this, and we're going to get through it, because that's what we do.
What I would like to see, and this is just me and my sociology brain thinking, if individuals could take one street, one block at a time, those of us who are able-bodied, those of us who have different skills, go just walk the block, check on your neighbors, take a list of names, addresses, emergency contacts, things of that nature. Maybe our city council members, I know again we're practicing social distancing. However, those who have been vetted to be in the clear, I don't know how this is going to look. I know there's going to be a lot of logistics behind it. However, I have brain power, so I'm willing to offer my brain power.
Yes, ma'am. No, you're exactly right. We can figure this out. This is not too big. This is not bigger than us. We can figure this out. And I think the ideas that you just threw out there, I think those are phenomenal. I think those are the things we need to latch on to. We need to work through the logistics on how it would work in different communities. So yeah, I agree with you.
All right, Dr. Speights, I have a question for you. Of course, we've been seeing people that are self-quarantining and some people who have possibly even been ordered to quarantine. And typically the quarantine has been for a period of 14 days. So could you explain to the listeners and viewers why that 14 days in quarantine is necessary?
Yeah, absolutely. And I think I'm going to take a minute too. Let me explain the difference between quarantine and isolation. Quarantine means that you came in contact with somebody that had the virus, or you traveled to an area where the virus was circulating and was known to be. And so there's a chance that you may have it. So you don't have any symptoms, you don't feel sick, you're not sick, but we're telling you you need to quarantine. And you need to quarantine for 14 days, which means you need to stay in your house. Now, when we tell you to quarantine, whoever lives with you in your house is also going to be quarantined for 14 days. That's different than isolation. Isolation means you're sick, means you got symptoms, means you don't feel good, and now you have to stay in your house for a minimum of 14 days as well. Why we say 14 days, and this is a big deal, when you get this virus, so when you get infected with this virus, you may have it for a couple of days or so before you even know that you have it. And what I mean by that is you may feel fine, but you're actually spreading the virus. And that's why this virus is spreading so rapidly. And that's one of the main differences about this virus, is that people can spread it and not even know it. And the average incubation period, it can be about 5 to 8 days, but it can be anywhere from 2 to 14. So it's a long incubation. It's a long, broad range there in terms of the incubation period. And when I say incubation, that means the time that it can reproduce. So the virus is reproducing and about to show symptoms. So it can be between 2 to 14 days before you show symptoms, which means you can pass the virus on during that time period and infect other people. Does that make sense?
Absolutely it does. And could you explain to the listeners and viewers just how the coronavirus actually works? Because I think a lot of people don't even know how it actually works once it enters the body.
Okay, so what happens is, and I'm going to give you just a little bit of the history. This virus came from China, and it wasn't a human virus to begin with. It's actually a virus that was in bats, of all things. Well, over in some countries, the general population has closer proximity to their animals, to the different animals they have, their different livestock. And so this was a virus that made a jump from bats to humans. And so it's not a virus that was typically seen in humans. So when that happened, all of a sudden it started causing, because it's a lung disease, it's a respiratory, so it means it kind of can hang out in the air for a little bit. It got inhaled by some humans over in China, and they started having an outbreak of pneumonia. And so the health officials there in China recognized this was a different kind of pneumonia than they'd seen before, and so that's when they started studying it, and that's when they came up with what kind of virus it was. Now, what really happens is if an individual that's infected with it coughs, then the virus can kind of hang out there in the air for a little bit, and somebody can come by and inhale it, or if somebody coughs into their hand and they touch a doorknob or they touch a desk or a tabletop or whatever it is, the virus can live for, depending on what we read, anywhere from 48 hours or so up to 72 hours or so. It can live on those surfaces, which is why you're seeing everybody use the Clorox wipes, and they're wiping everything down, and everybody's washing hands. That's why we make a big deal about washing hands or using hand sanitizer to kill that virus, so that if you happen to get on your hands, you don't wipe your nose. Some studies show that we touch our face maybe 15 times an hour, depending on what you read, anywhere between 8 to 22 times an hour is how often we touch our face. So if you get that virus on your hands and touch your face, then you're starting to kind of put it up there close to your nose where you can inhale it. Once it gets into your nose and can travel down through your throat into your lungs, what happens is it starts to break down the inside of the lung lining. And then your body recognizes it as something that's foreign. And sometimes your body can overreact, and as it starts going after this virus, it can start killing the good cells as well as the bad cells, and just kind of cause this huge response. Once the lung lining is kind of broken down, once your defense barriers in your lungs are broken down, now all of a sudden you're open to all these other things that normally that wouldn't make you sick, different viruses and other bacteria. So it's almost like this virus kind of breaks through your castle wall, so to speak, and now all of a sudden everybody else can kind of come in and wreak havoc. Does that make sense?
Absolutely. And Dr. Speights, we want to just thank you so much for all of this great, valuable information that you have given us. And we definitely want to bring you back on periodically just to kind of give other updates. We got to get ready to wind up this segment, but anything else that you just want to get out there to the listeners, anything that we may not have covered?
Just the take-home points are going to be, we're making a big deal about social distancing. It is a big deal. If you shouldn't be in groups larger than 10 people, if you can do it by FaceTime or by Skype or by Zoom, you should do it. We're holding all of our meetings now through that. We've got great technology. We should be using it. You should be washing your hands religiously. You really should be. You should be washing your hands religiously. If you got plans to go on spring break, cancel them.
All right. But once again, Dr. Speights, we thank you so much for coming by. Well, you didn't come by, but joining us via phone, of course, as he mentioned, using this technology to get the word out there and to help keep people safe. And we just thank you again for all that you do. We're going to get ready to go into a break. When we come back, we'll have more. This is KLEK 102.5 FM.